Okay, hello everyone. Welcome back. This is vlog number 3 for the American Heart Association. If you don't know me, my name is Abigail Davis. Today it's really important and going to be a really fun time because we have a special guest, Dr. Eble. He works at Arkansas Children's Hospital, and he is a pediatric cardiologist. And I actually met with him whenever I was 16 years old. I was a part of the Sweetheart program for the American Heart Association, and he took us on a really fun tour and told us a little bit about what he does. But thank you, Dr. Eble, for joining us today.
You're welcome. Thanks for having me, Abby.
Okay, so tell us first a little bit about what you told us at the Sweetheart program, like what you told us about, like what you do every day. What is that like?
Yeah, so for the last decade or so, I've had the real privilege of getting to take Sweethearts around on a tour of the Children's Hospital here. And I get to explain what I do, the kinds of heart problems that babies and kids can have, how we go about thinking about that, and how we can go about fixing it, either in the cath lab or with surgery or with medication, how we take care of them before and after and during their surgeries, and then how we keep an eye on them to make sure that they stay healthy and that their hearts stay great, and that those kids can grow up and have normal, active, healthy lives as much as possible. So that's one of the real amazing things that the American Heart Association has done, is get these young women involved early at a pivotal time in their lives.
Right, and of course. Okay, so guys, also y'all know that I haven't had a name for my vlog. Well, we've had some suggestions, and it is called the LubDub vlog, Hearing the Heart of an Advocate. And I know for me, I never heard what LubDub was, but Dr. Eble 100% knows, and he's going to tell us a little bit about what that means.
Absolutely. So it's funny that you guys brought this up to me. So LubDub is the way we teach medical students to make sense out of heart sounds. So what heart sounds are is when you put a stethoscope over somebody's chest, you normally hear the valves of the heart open and close. And the sound that it makes sounds like lub-dub, 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 lub-dub. And the dub, the second of the two heart sounds, actually changes when somebody is breathing in or breathing out. And so the LubDub is the noise that's actually made by the blood slamming into the backside of those heart valves as those valves close, when the heart is relaxing and filling up with blood, and then when the heart squeezes and ejects that blood either out to the lungs from the right side of the heart or out to the body from the left side of the heart. And so the LubDub is how we describe those normal valve noises when you listen to somebody's heart with a stethoscope.
Okay, wow, you just explained that. That just blew my mind. That's amazing that you said that. No, I'm so excited. That's such a fun name, and it's just so original, and I would have never thought of that. So that's so fun. Last but not least, so the Heart Association really is focusing on cardiac rehab and increasing access to quality cardiac rehabilitation care of 2021. It's a mouthful, but it's so important. So this legislation is going to help with so many things. It addresses disparities in enrollment and access to cardiac rehab by allowing physician assistants, nurse practitioners, clinic nurse specialists, also known as APPs, to begin ordering and supervising cardiac rehab for patients beginning in 2022. This would allow for quicker referrals of patients to those life-saving programs. It would help me, it would help the American Heart Association and so many other text rehab to 46839 to get involved and help out with that. But other than that, thank you so much, Dr. Eble, for being here. It's been so fun. You're so good at explaining things that just blow my mind. You're so smart. And it was so fun doing the Sweetheart program with you. And I hope to connect later on in the future.
Count on it. That would be great. I'm very, very proud of everything you're doing, Abby. Keep up the good work.
Oh, well, thank you. Okay, guys, make sure to tune in for month number 4.